WHO declares mpox outbreak in Africa a global health emergency. The World Health Organization, WHO, has designated the rapidly spreading pox, previously known as monkeypox, outbreak in Africa, as a global health emergency. This is the second time in 3 years that the WHO has made such a declaration. The first being in July 2022 when the virus spread to over 100 countries and affected nearly 100,000 people, primarily among gay and bisexual men, resulting in around 200 deaths. The current outbreak poses a more severe threat, particularly in Africa. Since the beginning of 2024, the Democratic Republic of Congo, DRC, alone has reported over 14,000 pox cases and 524 deaths. Women and children under 15 are among the most vulnerable groups. The outbreak has now spread to 13 African countries, including some that had never reported mpox cases before. On Tuesday, the Africa Centers for Disease Control and Prevention, Africa CDC, declared a public health emergency of continental security. The first time the agency has taken such action since receiving this authority from the African Union last year. Emergence of a new variant. The detection and rapid spread of a new clade, genetic group, of mpox, known as clade IB, in eastern DRC and its appearance in neighboring countries that had not previously reported the virus is particularly worrying. Clade IB is noted for its higher transmissibility and more severe health implications, with a death rate of around 3 to 4%, compared to 0.2% in the 2022 outbreak. Global response and vaccine availability. The WHO's declaration of a public health emergency of international concern is intended to prompt member countries to prepare for the virus's potential spread and share vaccines, treatments, and other critical resources with poorer nations. However, vaccine availability remains limited, with only 15,000 doses of Jynneos, made by Bavarian Nordic, donated to African countries. A fraction of the 10 million doses needed to control the outbreak according to the Africa CDC. Lessons learned and future preparedness. The rapid spread of mpox in Africa highlights the need for concerted international action to stem the outbreak and prevent future epidemics. Experts emphasize the importance of learning from past experiences and focusing efforts on containing the virus before it has the chance to spread globally once again.